Students at a Perry County school are being told to leave the energy drinks at home. Parents and guardians of students at Robinson Elementary and Combs were told under a new policy, energy drinks would no longer be allowed in the classroom. Principal James Fugate said the ban was put in place over concerns about health and focus. He said students showed signs of restlessness, difficulty concentrating, and even headaches or stomach discomfort after consuming the energy drinks. He's encouraging students to bring water, juice, or, quote, a school-appropriate beverage. A pediatrician we spoke with from Norton's Children's Hospital says children under the age of 12 should not be consuming the energy drinks. She outlines the potential health risks associated with the drinks in today's medical news.
You know, one of the main things you think about with those energy drinks is the relatively high caffeine content in those drinks. So for comparison, an energy drink has probably like 80 milligrams of caffeine per serving. And most of those tall cans are 2 servings. So they're getting like 160 milligrams of caffeine in the one container of the energy drink. And just for comparison's sake, like a soda is between like 30 and 40 milligrams of caffeine. So it's quite a bit more, caffeine than they would be consuming in a drink that most children have probably consumed. The other thing about the energy drinks is it's not only the caffeine content, but there's typically a large sugar content as well, and then multiple other stimulants that probably really haven't been studied in children as far as their safety profile is concerned. So all of those things kind of lead to this like compounding effect of like multiple things within that one can that have negative consequences. You know, as far as the safety and the medical side effects, there's really no studies that say that any amount of caffeine is safe in a child less than 12. So there's not necessarily a federal guideline, but the general recommendation is that children less than 12 really should not be consuming caffeine. And then in the teenagers, the 12 to 18-year-olds, the recommendation is to limit to less than about like 100 milligrams of caffeine. Health-wise, we do see a lot of issues with like the hyperactivity. So that may be where the focus question was coming into play. Can get, you've had too much caffeine, you get that jittery feeling, you feel a little anxious. And so for sure could be distracted in that sense in the classroom if we're getting the caffeine jitters. We can also get nausea and a poor appetite from caffeine, and then like having the caffeine on an empty stomach just kind of further exacerbates all of these side effects of the caffeinated beverages. Kids can get like headaches, dizziness, dehydration, and then we definitely see issues with trouble sleeping, which is a problem for a lot of people, but then further exacerbates the issues paying attention the next day if you didn't sleep well. If your kids are asking for the energy drinks, I would strongly recommend against it. Just say no. It's one of those like slippery slopes. If you let them have it this time, they're going to ask for it again the next time. And I also encourage parents to think about the example you're setting for your children with what you're drinking as well. And if they see that you are consuming the energy drinks or even, large amounts of soda, they're going to think that's what they should drink. So thinking, am I putting forth an example to my kid that reflects what I want them to do? If I want them to drink water, then I need to be, drinking water as well.
At least one other Kentucky school, Lincoln County Middle School, has a policy banning energy drinks in the classroom.